Hello, my name is Jude Ayman. I'm a third-year medical student, and today I'll be explaining external and internal features of the heart plus the coronary arteries. Now, unfortunately, this is being recorded. However, if you have any questions, please feel free to text me or email me at any time. So we'll be starting with the external features of the heart. Let's start with the location of the heart. Where is the heart located? The heart is located in the mediastinum. And what's the mediastinum? It's basically the area between the two pleural cavities. Now, I know you guys have a whole lecture about this, but just a small point about the mediastinum is how do we divide the mediastinum? We divide the mediastinum depending on the sternal angle. طيب? So if you put your hands on your sternum, you feel a slight bump. This slight bump is the sternal angle. If you draw an imaginary line between the sternal angle and the fourth and fifth vertebrae, you divide the mediastinum into superior and inferior. تمام? This is just an X-ray showing you the mediastinum, and obviously these are the two pleural cavities. Now let's talk about the covering of the heart. The covering of the heart, also known as the pericardium, is divided into two, serous pericardium and fibrous pericardium. Okay, the serous pericardium is then divided into visceral and parietal. So let's take a look at this. This is the endocardium. تمام؟ بعديها the myocardium. After that, the epicardium or the visceral layer of serous pericardium. They're the same thing. بعديها we have pericardial cavity filled with fluid to basically reduce friction. We then have parietal layer of serous pericardium, and finally fibrous pericardium. طيب? So again, endocardium, myocardium, and then we'll be talking about the serous. So visceral layer of serous. Between it we have, after it we have the pericardial cavity, then the parietal layer of the serous pericardium, and finally the fibrous pericardium. Now I just want you to note that the visceral layer and the parietal layer are connected together. تمام? Now let's talk about the fibrous pericardium. Fibrous pericardium continues superiorly is continuous with the great vessels. طيب. Inferiorly with the diaphragm. Laterally with the pleura. Posteriorly we have the esophagus, the bronchi, they're just closed يعني. And anteriorly with the sternopericardial ligament. تمام? Now, what is cardiac tamponade? Cardiac tamponade is when there is excess fluid in this cavity we spoke about. طيب? So normally we have around 50 ml. If there is excess fluid, we have cardiac tamponade. And how do we treat this? Basically by pericardiocentesis. So what we do is we insert in a syringe and we drain the extra fluid. تمام? Okay, now let's talk about the blood supply of the pericardium. We'll talk about the arteries first and then the veins. Okay, so we have two main arteries that supply the pericardium. The descending aorta, branches from the descending aorta, that's one. The second one is the internal thoracic or the mammary. So as you can see, this is the subclavian artery. It gives the internal thoracic artery, which then gives branches. What are these branches? Musculophrenic, superior epigastric, and pericardiophrenic artery. So all of these supply the pericardium. تمام? Now let's talk about the veins. We have accessory hemiazygous vein and hemiazygous vein. Both of these drain into the azygous vein, which then drains into the superior vena cava. So to recap, we have two main arteries, branches of the descending aorta and the internal thoracic artery, and obviously its branches. For the veins, hemiazygous and accessory hemiazygous, they drain into the azygous vein, or they don't join, they both drain into the azygous vein, which then drains into the superior vena cava. تمام? What about the nerve supply? The nerve supply of the pericardium is divided. The fibrous and the parietal part of the serous pericardium are innervated by the phrenic nerve. Okay? And what else does the phrenic nerve innervate? It innervates the diaphragm. It gives motor fibers to the diaphragm. So, and this phrenic nerve comes from C3, C4, C5. So how I remember it is a mnemonic, C3, C4, C5 keeps the diaphragm alive. تمام? So it gives the motor fibers to the diaphragm, and it innervates the fibrous and parietal part of the serous pericardium. Now we have the visceral part, صح? Visceral part of the serous pericardium. This is innervated by branches of sympathetic trunk and vagus nerve. Sympathetic and vagus nerve for parasympathetic. And you'd see later that this is the same innervation for the heart. Tamam? Or like the SA node, AV node, we'll be discussing it. But now let's discuss the heart. First of all, the right atrium receives all of the deoxygenated blood, صح? It receives it from the superior vena cava, inferior vena cava, and كمان coronary sinuses. Okay? The deoxygenated blood then goes to the right ventricle, صح? What is this valve called? The tricuspid valve. We'll come back to it later. From the right ventricle, it goes to the lungs through the pulmonary artery to get oxygenated. When it comes back, it goes through the pulmonary vein into the left atrium, صح? And then into the left ventricle, and then to the aorta. طيب. Now notice how we have 4 valves here, صح? The valves are divided into 2. Atrioventricular valves are valves between the atria and the ventricles, so tricuspid and mitral. And we have the semilunar valves, which are the pulmonary valves and the aortic valves. تمام? طيب. Now, the heart now for the external features of the heart, let's start with the sulci. We have 3 main sulci. Anteriorly, now we're looking at the heart from the anterior aspect, صح? Anteriorly, we have this sulci, which is anterior interventricular sulcus, okay? What is a sulcus أصلا? Sulcus is basically a groove that has fat or the vessels run through it, تمام? That's it. So anteriorly, we have the anterior interventricular sulcus. And then if we flip the heart, okay, we look at it from the other side, we have 2 more sulci. We have the posterior interventricular sulcus, and we have the coronary sulcus. Tamam? That's it for the sulci. Now for the 3 surfaces of the heart, we have first the anterior surface or the sternocostal surface, which is this surface, صح? Now, once you look at this, what do you mainly see? You mainly see the right ventricle and the left ventricle, صح? وكمان you see a small part of the right atrium. So these 3 are what make up the anterior surface, but mainly the right ventricle. Right. The next surface is the posterior surface or the base. Basically, if we look at the other side of the heart, we can divide the heart into 2 surfaces, posterior and inferior. تمام? How is this divided? By the coronary sulcus. So whatever is above the coronary sulcus is the posterior surface or the base. Whatever is under the coronary sulcus is the inferior surface or the diaphragmatic. Tamam. So above the coronary sulcus, what do we mainly have? The left atrium. So the left atrium is what makes up the posterior surface. For the inferior surface, which is under the coronary sulci, we mainly have the left ventricle and the right ventricle. Finally, we have 4 borders of the heart: superior, inferior, right, and left. صح? What makes up the right border? Right atrium. What makes up the left border? Mainly the left ventricle and some part of the left atrium. What makes up the superior border is the root of great vessels, صح? And what makes up the inferior border is the right atrium and right ventricle. ليه؟ لأنه the heart sits obliquely on the diaphragm. So this would be the inferior part. So right atrium and right ventricle. Now let's talk about the pericardial sinuses. This is probably discussed in embryo, but to kind of quickly understand it. The heart starts as a tube. This is the arterial side. This is the venous side. تمام? You can see here this is the visceral pericardium, and this is the parietal pericardium. تمام? Now what happens is that this tube starts folding, basically. طيب? So you see this area marked as T, it basically disappears. تمام? What forms there or what's there بعديها? The transverse sinus. So the transverse sinus is between the visceral pericardium of the aorta and the visceral pericardium of the pulmonary trunk. تمام? This is the transverse sinus. What about the oblique sinus? The oblique sinus is where the visceral layer, صح احنا we said here, and the visceral layer and the parietal layer are connected, صح? So where the visceral layer folds to form the parietal layer is then called the oblique sinus. طيب? Now, why are these important? The transverse sinus, this is the transverse sinus. It's very important because surgeons use it to clamp the arterial side during surgery. تمام? Temporarily, obviously. Now, for the oblique sinus, behind it, we have the esophagus and we have the carina. If for any reason there's an enlargement or fluid buildup, then we'll have difficulty swallowing. That's it for external features of the heart. Next, internal features of the heart. Right. We'll start by discussing the fetal circulation. So, the blood, oxygenated blood, comes through the umbilical vein. صح? Now, I forgot to mention this earlier. It's basically all arteries carry oxygenated blood except for we have two exceptions. طيب أول واحدة the pulmonary trunk. So the pulmonary trunk or the pulmonary artery takes the blood from the right ventricle to the lungs to get oxygenated. صح? It's deoxygenated blood. But this is the first exception. The second exception is the umbilical artery. The umbilical artery carries deoxygenated blood while the umbilical vein carries oxygenated blood. تمام؟ طيب. So we get the oxygenated blood from the umbilical vein and then usually right now يعني احنا when we're old it goes through the liver and then the IVC and then so on. طيب. In the fetal circulation لا. We avoid the liver. We basically go directly into the IVC. How? Through ductus venosus. طيب. Once we go through the IVC طبعا we end up in the right atrium. Now, from the right atrium, where do we go next? We usually go to the right ventricle and then to the lungs. However, this time the blood is oxygenated. There's no need to go to the lungs. صح? Also, the lungs are non-functional. So what we do is there's a small opening between the two atrias, the right atrium and the left atrium, called the where is it? Foramen ovale. طيب. So the blood basically comes from the IVC, and instead of going from the right atrium to the right ventricle, it goes from the right atrium to the left atrium, so that it could go directly into the aorta and to the body. تمام? However, some of the blood does not go through the foramen ovale. It goes through to the right ventricle. But after the right ventricle, it goes to the pulmonary artery. But again, as I said, the blood is already oxygenated. The lungs are non-functional. I don't want to go there, okay? So in case I missed the first exit, I can go with the second exit. What's the second exit? Second exit is the ductus arteriosus. Ductus arteriosus is basically an opening between the pulmonary artery and the aorta. تمام? So in case the blood went to the right ventricle and then went to the aorta to the pulmonary artery, we can still go back to the aorta to go to the body. تمام? Now, طبعا once we're old يعني once we're born or once this fetal circulation we no longer need this fetal circulation خلاص the ductus venosum this one it becomes ligamentum venosum and the ductus arteriosus which usually used to connect the aorta and the pulmonary trunk becomes the ligamentum arteriosum. The foramen ovale becomes the fossa ovalis. Umbilical vein becomes the ligamentum teres. The umbilical artery becomes medial umbilical ligament and superior vesical artery. طيب. Now again, this is the ligamentum arteriosum, which was once the ductus arteriosus. طيب. An important thing to note about this area is, as you can see here, there's a nerve going in this tight place. صح? It's called the left recurrent laryngeal nerve. It's a branch of vagus nerve, and it goes up to supply the larynx. Now, if for any reason this left recurrent laryngeal nerve gets compressed, then the patient would present with hoarseness. Now we're finally into the heart. Let's start with the right atrium, okay? The atria has a rough and a smooth part. So the rough part is called the pectinate muscle, and all of the rest is smooth. طيب? What is the cutoff? Where is the place where I can say, okay, this was rough and now this is smooth? It's called the crista terminalis. It's this one, right? It basically separates the rough from the smooth. An important thing to note about the crista terminalis is that imagine this is closed, طيب? You can see here we have the SA node, which is superior, in the upper end or superior part of the crista terminalis and below the SVC, صح? But obviously subendocardial. Another thing we have is the eustachian valve. What is the eustachian valve? This is another thing that had a function basically in our fetal circulation. Because we said we want to go from the IVC into the foramen ovale, صح? We don't want to go to the right ventricle. So the eustachian valve basically redirected the blood from the IVC towards the foramen ovale. طيب. We also have the Tibicean, I honestly don't know how to read this, but you guys get it. This is the valve of the coronary sinus, which is the main venous drainage of the heart. We'll be talking about it later. طيب. Right ventricle. We have trabeculae carni. Okay, here we had what? Pectinate muscle, صح? Here we have trabeculae carni. We also have the tricuspid valve, which has so 3 cusps, anterior, posterior, and septal. طيب. These cusps are made up of dense CT covered by endocardium. تمام? طيب. What else do we have? We have papillary muscles and chordae tendineae. So what is the function of papillary muscles and chordae tendineae? Basically, when the ventricle contracts, we want the blood to go from the ventricle into the pulmonary trunk, صح? Or if it's the left ventricle, to the aorta. طيب. We don't want it to flow back into the atria, صح? So, what the papillary muscle and the chordae tendineae do is that the papillary muscles contract. طيب. Once the ventricle starts contracting, the papillary muscles contract. For the chordae tendineae becomes tense, for they close the valve. They make sure there won't be any backflow of blood. Okay? During diastole, which blood moves from the atria to the ventricles, the papillary muscles are relaxed, so the chordae tendineae is slack, and the AV valve is open. تمام? Papillary muscles. Okay. Moderator band. What is a moderator band? Moderator band is where is it? It's this one. Okay. So what is the function of moderator band? It carries part of the right bundle branch to the anterior papillary muscle, as you can see. We're going to talk later about the right bundle branch, but it's basically here. So it carries it from this part into the anterior papillary muscle, which is this one. تمام? And why does it do this? To synchronize contraction. So basically, we want to make sure the right ventricle and left ventricle are contracting at the same time. So this is the function of the moderator band. There are other functions such as preventing sudden dilation of the right ventricle, helping divert blood from entrance to exit. But these aren't important. This is the most important one. Finally, we have the infundibulum, which is this area or conus arteriosus before the pulmonary valve. Left atrium, alhamdulillah, there's nothing special about it. Left ventricle. Okay, so now we want to pump blood from the left ventricle into the body. صح? This is like a huge distance. That's why the wall is 3 times as thick. Okay? Come on. The mitral, the mitral valve is also called the bicuspid valve. 2 cusps. تمام? We also have 2 papillary muscles. We have trabeculae carni, just like the right ventricle. And we have aortic vestibule, which is this area. It's smooth and fibrous, and it's before the aortic valve. تمام? After the valve, just above the valve, we have openings to the coronary arteries. Okay? So we're going to talk about this later as well. What is the clinical aspect of this? We said that the foramen ovale is an opening between the right atrium and the left atrium. صح? Now, if this foramen ovale fails to close, we'll have atrial septal defect. طيب. For the ventricular septal defect, this is the interventricular septal. طيب. There's a membranous part and a muscular part. Ventricular septal defect usually happens in the membranous part. Cardiac fibrous skeleton. So, the fibrous skeleton forms rings around the valves. So this is fibrous ring of aortic valve, fibrous ring of pulmonary valve, left atrioventricular ring, and right atrioventricular ring. طيب. وكمان, what else does it do other than forming rings? The cusps basically attach to this fibrous skeleton. طيب. How can we differentiate between aortic and pulmonary? As you can see here, this is the pulmonary valve. It has left, right, and anterior cusp, while the aortic valve has left, right, and posterior cusp. طيب. This is an important difference. Make sure you know it. Conduction system of the heart. as we know, SA node is the pacemaker of the heart, صح? So it sends electrical impulses first to the atria to make sure, to the right and left, to make sure they both contract at the same time. These impulses then go to the AV node. Now we said the SA node is on the upper end of the crista terminalis below the SVC, صح? Where is the AV node? AV node is in the interatrial septum. تمام? So SA node sends impulses to the atria and then to the AV node. Through the بعد ال AV node, it goes to the bundle of His, and then right bundle branch, left bundle branch, and ventricles then contract. Okay. Autonomic innervation of the heart. Now remember how we said in the pericardium, the innervation of the pericardium was divided into two. صح? The visceral part of the serous pericardium had a different innervation. صح? It was innervated by the sympathetic chain, sympathetic trunk, and the vagus nerve. Okay, so this is the exact same innervation of the heart. Sympathetic, they originate from the lateral horns of T1 to T4. Okay, and they terminate in the SA and AV nodes, obviously, because they're the pacemakers, command cardiac muscle fibers, and coronary arteries. What is the overall effect? Sympathetic is fight or flight, صح? So if sympathetic is higher, basically, the heart rate would increase and the force of contraction would increase as well. What would happen to the coronary arteries? They dilate, صح? And they're working more, so they need more supply. Where the parasympathetic, it's innervated, the heart is innervated to vagus nerve, but the overall effect is the exact opposite. So decrease the rate and force and constrict the coronary arteries. Okay, so heart sounds and auscultation. We have two normal heart sounds, okay? S1 and S2. S1 lub is the closure of the AV valves, or the tricuspid and mitral valve, and S2 is the closure of the semilunar valves, which are the aortic and pulmonary. Now for the auscultation, do you guys remember the sternal angle I spoke about? If you put your hand on your sternum, you'd feel a bump. That's the sternal angle, صح? So this is very important here. Why? لأنه the sternal angle is very close to the second rib, صح? So if we locate the second rib, we then know where to auscultate, okay? And it's basically like landmark. So you auscultate for the aortic valve at the second intercostal space to the right, for the pulmonary second intercostal space to the left, then go down to the tricuspid, left lower sternal border, and finally the mitral is the fifth intercostal space, mid-clavicular, which is the apex, okay? So second intercostal space to the right is aortic, pulmonary second to the left, tricuspid lower beside the sternum, finally fifth intercostal space, mid-clavicular is the mitral. Right? You have to memorize these by heart. Borders of the heart are not that important. They're very easy. مثلا superior border, basically the pulmonary and aortic connected, basically. So it goes from the left second costal cartilage to the third costal cartilage, and so on. Okay. I doubt this is important, because these are very important. Okay. Finally, the coronary arteries. Remember how I said above the aortic valve, we have two openings for the carotid arteries, صح? Coronary arteries. We have the right and left coronary arteries openings. طيب. Now let's start with the left because it's easier. The left gives two branches. It gives the LAD, left anterior descending artery. From the name, it comes from the left. It's on the anterior surface and it's descending. تمام? And what else does it give? Circumflex artery, which this is the circumflex artery, تمام? Where it goes on the posterior side as well. That's it for the left coronary artery. For the right coronary artery, we have many branches. So this is the right coronary artery. طيب, it gives a branch to the SA node, it gives a branch to the AV node, it gives anterior atrial and ventricular branches, it gives right marginal branch, and most importantly, it gives posterior interventricular artery, which is the PIA. تمام? We'll be talking about this soon. Anything else? Yes. One thing, يعني انت from the branches, you know what artery supplies what. So if I ask you what's the what supplies the SA node, that's right coronary artery, صح? AV node, right coronary artery. Right atrium, right coronary artery. For the interventricular septum, it's divided into two. Some of it is supplied by the right coronary artery, some of it is supplied by the left coronary artery, okay? So the right coronary artery supplies the posterior 1/3 of the interventricular septum, while the left coronary artery, or specifically the LAD, because it comes anteriorly, supplies the anterior 2/3 of the interventricular septum. So, okay. Now, what's an angiogram? Basically, we insert a catheter through the femoral artery or sometimes the radial artery. We go بعدين we enter to the coronary arteries. تمام? Okay. And then we insert a dye or contrast. Okay. This is what we see. Right? This is extremely important. It can come in OSPI, it can come in SAQ, it can come anywhere. Right? How do you know if this is left or right? Let's take a look at this one first. You see this L-shaped. L-shaped is right coronary artery. Okay? L-shaped right coronary artery. Thankfully, we don't have to know all of these branches. We have to know only 2 branches. Okay? Which is the right coronary artery, which is basically the main artery. Okay? It's this one, number 2. And then we have 4 is PIA, or posterior interventricular artery. تمام? For the left coronary artery, you have to also know 2 branches, which are LAD and circumflex. أصلا هم the only 2 branches. Or the only 2 we have to know يعني. So number 4 is LAD, which goes anteriorly descending, and circumflex goes posteriorly. Okay? Right. Something called left dominance and right dominance. What is the difference? So basically, it all depends on PIA. Okay, if the left coronary artery gives PIA, this is called left dominance. طيب. And if the right coronary gives PIA, this is called right dominance. Now, thankfully, thank God, most of us, 70% of us have right dominance. ليه؟ لأنه if we have left dominance, the heart will be too depending on the left coronary artery. يعني anteriorly we have LAD, which is from the left coronary artery, and كمان posteriorly PIA would be from the left coronary artery. So if we have a blockage there, خلاص, we're done. Okay. So alhamdulillah, most of us are right dominant. We have right dominance. However, there are some people with left dominance. That's it for the arteries. Now for the veins. The main three are great cardiac, middle cardiac, and small cardiac. Okay. The great cardiac vein, it runs with LAD anterior. تمام. The middle cardiac vein, it runs with PIA posterior. And finally, the small cardiac vein. Okay. Now, where do all these veins drain? All 3 veins drain into the coronary sides. Okay. Which then drains into we mentioned it, into the right atrium. تمام. Finally, myocardial infarction. So, patient presents with pain described as constricting or crushing weight or pressure, whatever. Okay. The pain can radiate to the shoulder, can radiate to the jaw, can radiate to the abdomen. Okay. What is the reason behind the pain, or what is the reason for myocardial infarction? So basically, it's occlusion of coronary artery, زي ما we see here. Okay. Like, what is the reason behind the distribution of the pain? Basically, we have dermatomes. Okay. Remember, we said the pericardium is innervated, and the heart, the visceral pericardium and the heart are innervated by T1 to T4. صح? If you take a look here, T1, T2, T3, T4. Okay? You can see that they go to the arm. صح? So basically, what happens is that you don't feel pain in the heart. The heart cannot feel anything. You feel pain in the dermatomes, okay? Which are places where the pain radiates to, okay? So طالما احنا our innervation is from T1 to T4, then it can radiate in the areas of T1 to T4, okay? So you won't feel the pain exactly in your heart. You feel it in your chest, you feel it in your left arm, so on. What is the imaging technique used? We said angiography, صح? We took this. This is an example of an occlusion. You can see the contrast is missing a bit here, okay? What is the treatment? We insert a balloon, inflate, and then insert a stent, okay? That's about it. Okay, so another thing Dr. Atif mentioned, as I doubt he's gonna ask, he said it's not your level. There's something called triple vessel disease, okay, which is basically very extreme coronary artery disease. In that case, we do coronary artery bypass graft. Okay, don't get into details. Inshallah, he won't ask about it. Okay, question time. 55-year-old man presents to the emergency department because of a stab wound to the chest. Which of the following chambers of the heart is most likely to hit? So, a stab wound could be anterior, صح? And what is the main part of the heart that forms the anterior surface? We said right ventricle. Okay, so the answer here would simply be right ventricle. 76-year-old man presents with a systolic murmur that radiates to the neck. He was diagnosed with aortic stenosis. Where are the aortic valve sounds best auscultated? We said aortic, or the aorta, is best auscultated in the, giving you guys time to think. Okay, in the right second intercostal space. طيب, what's in the left second intercostal space? Pulmonary. What's in the left fifth intercostal space, mid-axillary? It's the mitral. And what's in the left fourth intercostal space, parasternal border, or basically the lower sternal border to the left, is the tricuspid. So our last question, 67-year-old man presents to the clinic with severe chest pain that he describes as pressure-like. Pain radiates to his shoulder and left arm, so MR. The patient soon expires. Autopsy reveals the patient was left dominant. What does that mean? Now we said dominance depends on PA. If the patient is left dominant, then PA comes from the left coronary artery. If he's right dominant, then PA comes from right coronary artery. So does that mean the heart is fully supplied by left coronary artery? Does left dominant mean that? لا. Does it mean that the right ventricle is supplied by the left coronary artery? No. The posterior interventricular artery comes off the right coronary artery? No. Posterior interventricular artery comes off the left coronary artery? Yes, this is the right answer. That's about it. I hope you guys benefited. If you have any questions, please don't hesitate to ask me. This is my very first class session, so please give me feedback so I can improve. And thank you.